This is an Eyewitness News special. Back to school, new lessons.
For the first time in months, students are returning to the classroom. Reopening schools might not be easy for some districts. Keeping them open may be even more challenging. Hello, everyone. I'm Brad Bird, and welcome to our special program tonight, Back to School. Talking with those educators being put to the test as COVID-19 has made a typical day in school anything but. Well, I'm joined tonight by my colleague, Shelley Kirk. And Shelley, we certainly have a lot of ground to cover.
We absolutely do, and we're going to do it tonight because on our Back to School new lessons this evening, here's what we're going to look at, and this is our agenda. 6 area superintendents will join our program remotely through Zoom. Now, these educational leaders represent Indiana, Kentucky, and Illinois, and some of the systems they oversee are already back in class as of tonight. Others are taking notes and getting ready for their first day.
And I sat down with Kentucky Governor Andy Beshear. His first 8 months in office comes as we face the greatest challenge of our lifetimes. We discussed the Commonwealth's response to the coronavirus pandemic and how he thinks schools will function this fall.
And of course, with the new school year comes sports. Student athletes in sports like football facing uncertainty. Sports Director Randall Parmley checks in with the Indiana High School Athletic Association on the future of fall sports.
Kentucky is a few weeks away from the start of school, but not everyone is on the same schedule. At the recommendation of the governor, public schools will start the year virtually, going back to class at the end of September. And that depends on if the Commonwealth's COVID-19 positivity rate is below 4%. As of today, that rate is 5.6%. Despite the recommendation, Catholic schools in Owensboro and across the Commonwealth are planning in-person classes to resume at some point this month.
Now, I've heard from many parents that are worried that schools will open just to shut down again. Now, in a matter of weeks, Indiana State Health Commissioner says that is unlikely, though. Dr. Christina Bach says the shutdown we went through last March was to ensure that hospitals could make the necessary changes to handle the outbreak without being overwhelmed. Now that has been accomplished, Bach says schools can reopen, but things will be very different. A critical part of returning to school, Dr. Bach says, students must stay home if they are sick. Well, students in the Tell City and Troy Township school system in Perry County went back to school last week.
Well, big changes are in place, of course, to help keep students safe. Eyewitness News' Noah Latza got a sneak peek the day before classes resumed.
Yes, that's fine.
It's back to school time, with a lot of students starting their day here at the bus stop.
To protect the kids and the drivers, we are going to be sanitizing the buses twice a day. So in the morning, when your child gets on the bus, we'll pick up all the students, drop them off at the school, and then my transportation director will get on and spray it down with a fogger that wraps around the seat and sticks to everything and has about a 2-minute kill rating for coronavirus and bacteria and things like that.
Name cards placing students of the same household are up, and masks will be required. As students enter the building, they'll be breathing ionized air. $50,000 invested in 8 ion generators.
And right now, there's 5,000 volts flowing through that thing, generating ions that are then pumped through our air handlers that you don't smell, you don't feel it, it doesn't interact with you at all, but it interacts with those microscopic particles that we don't want to interact with.
The ions are 90% effective at killing COVID-19 and other bacteria. Schuldeau says a fogging mister will also help expedite cleaning in classrooms. PE and lunch look much different too.
So we've limited our amount of kids in PE. Usually it's 2 classrooms at a time in a PE setting. We're going to drop that back down to 1. That means 20 to 25 kids across the whole gym. Socially distancing, masks down because you're exercising, but once again, that's where we've got the ion generators. So those ions are in there killing that virus while we're working out.
And when it's time to eat?
And we've bought serving trays and carts to where my cafeteria staff can load up an entire classroom's lunch on a cart, push it down to the classroom, and the students would eat in the classroom. So once again, it's that isolation, it's that pod living where we just keep everybody as separated from everybody else as we can.
Other changes include adding hand sanitizer stations across the building. It's a school year like none other, and superintendents like John Sholdo says the school year will be different, but keeping students safe is his top priority. Noah Alatza, Eyewitness News.
Well, Tell City was the first local school system to head back to class, and now that they have a full week in the books, it's time for a progress report. So joining me now over Zoom is John Sholdo, superintendent of Tell City Troy Township Schools. Mr. Sholdo, thanks for making the time for us with a very busy schedule, I'm sure. So 1 week down now, how's everything today?
We couldn't be happier with the way things have been going for us since we started last Tuesday. We've actually seen an uptick in our in-person enrollment because we've done so well. We've had some parents who were a little trepidatious to start back after about 3 or 4 days of hearing what we'd done and seeing it in practice. We've gone up to about a 90% in-person rate from about an 80-85. So we're happy with that result.
Yeah, that's very good news. Has anyone come down with COVID? How many kids out sick?
We don't have any confirmed cases of COVID. We do have some students who have been quarantined because of exposures. And we have a lot of questions from parents saying, well, my child has this symptom or that symptom, should I send them? And we've been erring on the side of caution and saying, if they don't feel great, keep them home, kind of watch it, and deferring a lot to the health department. They have been very, very helpful throughout the whole process. I'm probably wearing them out.
Yeah, and as far as right now, I hear a lot of school systems right now just saying, if you're sick, stay home, period, right?
Absolutely.
Yeah.
We're pushing if it's not something that you normally have. Like if you've got allergies and some sinus drainage, then, of course, get your doctor's note and come to school. But if it's something new or multiple symptoms like nausea and a headache, then we're definitely saying stay home and see how things ride.
Okay, well, Mr. Sholdo, what have you found surprising in this first week and a few days back?
Really, the smoothness of everything. The students have been phenomenal. We've not had problems with masks. We've not had problems with following directions. We're not crazy about all the seating charts and the separation because, kids naturally want to be social and gravitate towards each other. But they're doing a really good job, and our parents have been outstanding. Communication was our big push. We really wanted to establish that good communication with parents, and I think we've gotten it and then some. Most parents, teachers, everybody has said the first day of school, which is normally a really rough day for everybody, was one of our best in years. So I can't thank the students and the parents and the teachers enough for the great job they've been doing.
Yeah, that's great to hear. Now, you mentioned some quarantining and seating charts. Now, I know a lot of the seating charts is to facilitate contact tracing. Have you had to implement that so far?
The seating charts, yes, but we have not had to contact trace at this point. All the exposures that we've had have been away from school, and the quarantining is just because of that exposure. It's not because we've seen symptomatic progression here at school.
All right, so good news so far. Mr. Sholdo, thank you so much for checking in with us and giving us a really positive update. We really appreciate that. And best of luck to all the kids and teachers there in Tell City, Troy Township.
Thank you very much. Y'all have a good night.
Thanks so much. Well, we want to thank our roundtable of Tri-State school superintendents for taking time out of their busy schedules, really busy right now, to join us tonight.
Well, these are educators who have tried to navigate this ever-changing story and answer a simple question. What do we do now? We have Dr. David Smith, superintendent of the EVSC, Brad Schneider, superintendent of Warwick County Schools.
We also have Dr. Matthew Constant, superintendent of Owensboro Public Schools, Dr. Deanna Ashby of Hopkins County Schools, Superintendent Morgana Stanley of Henderson County Schools, and Dr. Chuck Blyer, the superintendent of Wabash Community Schools. Thank you all so much for being here with us today.
Well, ladies and gentlemen, we are kind of in a classroom right now. This is a conversation, and if you would like to react to a comment made by a fellow superintendent, just raise your hand, okay? That's all it needs. And we appreciate, again, you being here. First of all, I'm going to ask Superintendent Brad Schneider. Basically, you started ringing the school bells Wednesday. A day later, 2 students have tested positive. With that said, what are your feelings about opening up right now?
Well, Brad, the opening itself has gone very well. I think it's important for people to understand the 2 students that did test positive today, they weren't infected at school. They brought the infection into school. The school administrators, the school team worked very quickly to identify those kids, isolate them. We started our mitigation protocol. So once we found out that they were positive, close contacts were identified. Those students and parents were contacted, explained that they were in close contact with someone that had tested positive for COVID-19. So they will be quarantined for 14 days. And we will hopefully, by attacking this quickly, we'll reduce that spread, and this incident will not, no other students will catch the COVID-19.
I certainly hope that is the case, and I know many other superintendents are taking notes here as you talk. Dr. Chuck Bleier with Wabash Community Schools, you all just started today, back to school as I understand. How did today go for you?
It went extremely well. We went with a hybrid system today where we had just half the students report. So the first half of the alphabet reported today, and tomorrow will be the second half. Went extremely well. The less congestion, able to follow protocols. I like to say that nobody's gone through teaching during a pandemic right now. So this is new to everyone, and we're trying to give everybody involved, all the parents, all the teachers, the students, a little practice before we get into full return, which we're hoping to fully return on the 24th. So far, so good today.
All right, good news.
Well, to Superintendent Margana Stanley, Governor Beshear, of course, has pushed back the start of brick and mortar classes to September 28th. For those students who are challenged by special needs or a lack of computer technology or poor Wi-Fi, what happens to them?
Well, we're very fortunate in the Henderson County schools to have one-to-one technology in kindergartens through grade 12. Our special needs teachers are working individually with our students. And actually, we've asked all of our teachers to make individual contact with all of our students to make sure we know what their technological capabilities are at their home. So we can make accommodations for them so they can be successful on NTI. Our NTI instruction as we start this school year will look very different than what it did in the spring. Our teachers have diligently worked through the summer, and especially since August 1 through professional development, and becoming more tech savvy and offer differentiated instruction for the kids based on what their needs are instructionally and what their capabilities are at home.
Well, Dr. Smith, let me ask you a question now. Now, you said at one point during one of your podcasts that you're really looking hard at the positivity rate in your decision on whether to begin in-person classes on the 19th of August. At that time, the positivity rate was, I think, over 10%. And the last reading we have on that is still around 10%. How is that going to affect your decision whether to bring in-person class on the 19th?
Well, that positivity rate is certainly one of the key factors that we look at, and you're right, it's hovering around 10%, but I think there's also some good news that the moving average of positive cases, when we announced the delay several weeks ago, that that moving average was at 50 cases a day. Now it's down to 35, and 35 cases, that's the lowest that it's been in over a month. So I think that's a positive sign. I think also when in that same podcast that you referenced, I did indicate that the governor's executive order of requiring masks hopefully was going to be one of those mitigation strategies that would see some positive benefit. It's now been in play for over 2 weeks, and I think that is one of the really driving forces that now we're starting to see those numbers trend downward a little bit. So I think there are some positive signs. Still certainly want to see that rolling positivity rate drop, but our colleagues that are in school already in the surrounding areas, I agree with everyone. I think they've had a phenomenal start because of the cooperation, collaboration that they have had with everybody. So at this point in time, we still are anticipating starting with that soft start on August the 19th.
And to all of our superintendents, we want to get you all involved in this conversation. I'm going to pose this to anyone who wants to comment now. How do you manage kids, especially young kids who are experiencing something that none of us ever experienced at that age, who are entering school. They have to wear face masks, of course, and maintain social distance, but say like a first or second grader, how is that going to happen, and how are you going to be working with them? Anyone who wants to jump in on that? Raise your hand. There you go.
I'll be brave and go. A campaign that we started a few weeks ago was just actually at the home, trying to get our parents to just start practicing with our students in wearing masks. And so it was a kind of a community embraced idea that would be very helpful to our students in just practicing ahead of time. We also have mental health therapists in the Henderson County Schools, as I know our colleagues do as well. And they've spent time reaching out to families. Our family resource centers, youth service centers have made sure that our parents and our students have masks, and that on that first day they would be able to be successful getting on the bus or coming to school. So a lot of it was, for us, was early preparation before they ever even set foot in the building.
And I think sometimes it might be easier for a child to wear a mask than some adults.
Yes,
it is not always comfortable, for sure. I want to open this.
Resilient.
Absolutely. I want to open this up now to some of our viewer questions. For the week preceding this, we've been asking our viewers to send in questions that they have. So I want to pose a question to Dr. Constant, Owensboro. Amanda Huff is a parent in the Owensboro Public Schools. She has a couple of questions. First, how many hours will our children have to sit in front of a laptop during the day? She also asks, if a student needs to miss due to a doctor's appointment, will that parent have to contact the child's school to say that they'll be out because they're learning virtually at home? Will they have to notify the school that they won't be on that laptop at that time? So first off, how many hours will the children be sitting in front of the laptop?
Well, our teachers are being coached right now as a shift from, of course, that traditional face-to-face instruction to what is reasonable in terms of screen time versus being away from the screen and working on independent work and coming back to the table. So I was able to reference a study that we have been looking at recently from the American Institute of Research, and over 450 school districts were surveyed here. And pretty much we all land in the same space. For grades K through 2, we're talking about maybe 2.25 hours a day. But for the middle schools it ramps up, we're talking a little bit over 3 hours, and we're approaching 4 hours for the high school. So we think that those are much more reasonable numbers to expect in the home, and as we're coaching our teachers as well. On the sick question, if we initiate especially COVID-related symptoms where we need to send that student home, of course, it would be an excused absence. And we would monitor and have the family monitor, and after 24 hours of fever-free without medication, they would be able to come back to school.
Okay, we want to bring in now Dr. Deanna Ashby with Hopkins County Schools. Dr. Ashby, several superintendents have said that our parents are really the first line of defense. Once they send those kids out the door in the morning or take them to school, what can be done to help get the kids taken care of, especially in a virtual setting when many parents, and several of the courses being offered right now are virtual, but many parents are working parents, either single or both parents working. How are those kids being taken care of in that situation?
Well, in Hopkins County, we believe one team, one mission, one community. And we know that it's certainly a team effort with all of us working together. And it's all about relationship building. So our teachers have already been working the phones, reaching out to the parents and the students, answering questions that they have. We've conducted surveys so that we can try to anticipate any needs or concerns that they have in advance. And so we're very excited. We're looking forward to August 26th when we will start through non-traditional instruction. And we're hoping to bring students in small groups, even at that time. So especially like our little ones who have never been in a school environment before, so they can see their room, meet their teacher, help them with transitional skills and start to build those relationships, not only with the students, but with the family.
He has been one of the high-profile governors in the country during this pandemic. Kentucky Governor Andy Beshear is just into his first term and has faced a tall mountain of challenges. And joining me now is Governor Beshear. Governor, first off, I hope you're feeling well. I know you were under the weather earlier this week. You tested negative. So how do you feel right now?
Well, I feel good. I'm not back to 100%, but I know what it's not. And I will tell you that going through that experience where all indications suggested that I was going to be positive, that my wife was potentially going to be positive, and waiting those hours, even though it was just hours, wondering what the near future for my kids would be like, gives me a newfound empathy for those that are going through this. I know it's tough on people mentally and emotionally who have to deal with this virus, but it's tough on all of our families dealing with these times. But I'm going to be all right. I'm good enough at 90% to keep on fighting this virus, make sure we get through it together.
Well, good to hear that. You recommended pushing back in-person learning to September 28th. Wednesday, Kentucky set a daily record of more than 1,100 cases. Governor, is that number, if that happens again or repeatedly, could that prompt another possible mid-course change in reopening schools?
Well, I believe in-person classes are so critically important to our youth. And I don't say that just as governor. I say that from having a son going into 6th grade and a daughter going into 5th grade. When we talk about developmental delays, when we talk about impacts socially and emotionally on children, my children are going through it right now. So I desperately want to get my kids back to school because I also really need to get them out of the house. But we've got to do it safely. I believe by September 28th, we will be able to do it safely. Our school districts have worked very hard. They've come up with really good plans, but a plan only works if the timing is right. And right now we are just seeing such an influx at this moment of COVID-19. And what we're seeing across the country with schools that go too early, having to shut down or have hundreds of families in quarantine, or the fact that we still have some families going to the beach at a time when they shouldn't, or adding on top that we have record numbers of kids testing positive right now, all just say that we need to be a little patient. We need to be patient because this has to work. We can't put our kids through opening in-person classes and immediately going home. We can't have hundreds of kids going through the trauma of quarantine because we didn't do it right. And I will tell you, I knew that it was going to be contentious when I made the recommendation, but my job is to make the hard calls sometimes when others won't. But by September 28th, I do believe we will be there. And I believe that we're going to get to watch every other school system in other states and probably a couple in ours that open. And we're going to learn from every single mistake, that our kids will not be the guinea pigs, that we will not experiment with them, that we will learn all of the best lessons and we will put them in place so that we're not the first, but we're the safest.
And Governor, you have children, as you've said, speaking of the kids. What have you and the First Lady told them about COVID-19? And I guess more importantly, what are they telling you?
Well, you know, the scare we had on Tuesday gave me a little bit of insight, and I'm not going to mean to be emotional, but I'm a dad, into how kids feel when they are in that situation, when they are waiting on a test. They asked us 3 questions. They said, "Are you going to die?" And I said, no, I'm going to be all right. I'm healthy. They said, "Am I going to?" I said, "Oh, no. And they said, "Who's going to take care of us if you're wrong?" And so these decisions are so important to get right. And that's what I'm trying to do, to make the best decision or recommendation as a dad. Now, my kids, sadly, have to hear about COVID-19 probably more than anybody's. But I will say, what you hear from all kids is a level of optimism and of resilience that we can all take a lesson from. My kids will wear a mask if they get to go back to school, and they're going to have to when they go. My kids understand that their actions could infect other people, and they see it as a joy to do the things to protect other people. They miss all those things that all kids do. They miss getting to hug their grandparents, my parents, and it breaks my heart not to be able to see that. But needing to do what it takes to keep safe. I think our kids are sometimes the very best of us in this. They're not making rash decisions. They're out there trying to do the right thing for other kids and for other people.
And in the brief time we have, Governor, kids are kids, and in reopening these brick and mortar classrooms again, whether it be 6 weeks from now or even longer than that, how do you get kids, youngsters, especially going up to third grade, to social distance, to keep those masks on? And teachers say they are worried because they are on the front line, and the superintendents I've talked to say that they need help from the parents, but just a handful of parents could change all of this if they themselves don't believe in wearing masks and social distancing. What do you think?
I think all of that is right, and that means that we've got to do this not only with the right plan, but at the right time. Especially the youngest children are going to have real trouble keeping the mask on, and kids have a real hard time social distancing. Until this, I don't think any of us noticed how close they like to stand to each other. A little bit different with adults, though we've had to spread out a little more than we used to. And so what that means is we've got to be realistic and understand the level of compliance that we're going to get. So in areas that are hot spots across our state, but really all of our state is a hot spot right now. That comes from the White House, not from me. We've got to understand that we've got to be patient to find the right time, knowing that we're going to get, I think, good compliance from our kids, but we're not going to get perfect compliance for our kids. And while there are some parents out there that I know are anxious, I feel that too, that believe it's their choice to take a risk with their child, that teacher doesn't get to make that same choice if they are called back to school. That janitor doesn't get to make that same choice. So we've got to think about all of us. And just remember, one family that might not be wearing a mask that they need, or one family, again, that goes to the beach at a time when it's really dangerous, can upset everything else we're working on doing. That's how fragile this is. There's a school system in Georgia that has over 1,000 people under quarantine right now for not doing it right. We must do it right, and I believe we can. But we can't let our anxiety and how long we've been cooped up dictate both what we do and the timing in which we do it.
All right, Governor Andy Beshear, thank you so much. You and your family stay safe, and the kids and teachers and educators in Kentucky stay safe. Thank you for joining us today.
Thank you.
And we are back with another round of questions for our 6 tri-state superintendents.
And I'm going to go to Dr. Smith first. I'll step back here. And Dr. Smith, Lee says he is a student in the EVSE. He wants to know, how many cases will it take for us to go to a shutdown? Do the cases have to be within the school, or is there a certain number in the area that would affect your decision?
There really is no definitive answer for that. As I mentioned earlier, we'll look at a lot of different evidence and different pieces of data. One thing that I don't think we've mentioned too much on this broadcast is that when we talk about cooperation with our families and our communities, if the number of individuals that have to be quarantined reach a certain amount to where we have that threshold that we have to report to the Indiana Department of Health as well as Vanderbilt County Health Department, about 20% absenteeism, then I think we would certainly seek the advice of local officials in the Vanderbilt County Health Department to see if that is the tipping point. But once again, it may not be positive cases. It may be because of activities outside our walls, outside the school setting, and individuals that have to be quarantined because they were in close contact in the community. That may also be something that we'd have to take into serious consideration.
All right, thank you, Dr. Smith. Let's go now to Dr. Deanna Ashby. Drusilla from Hopkins County has granddaughters in the Hopkins County school system. She asks this question: with this being my granddaughter's first time to go to school, how will it work for kindergarten? She's never been to school and would benefit from actually attending a school in person and getting in-person instruction. So that is going to be a very different kind of thing for kindergartners.
Absolutely. Starting kindergarten is exciting and scary all at the same time for the students and the parents in a normal year. And so just starting kindergarten in a COVID environment is very challenging. So while we are starting on a non-traditional instructional path, we still, as I stated earlier, intend on bringing small groups of students in. It's very important for them to feel comfortable, for them to see their room, to meet their teacher, to build the relationships, and for our teachers to talk to them and to their parents about the importance of wearing masks and social distancing and hand washing and how it's going to look as they go to eat lunch or go to recess. So again, it's about the relationships, and we are very sensitive to the fact of not only what our students are experiencing, but those parents who drop those kids off or put them on a bus for the very first time, and especially with the COVID challenges.
Yep.
Well, Superintendent Brad Schneider of Horry County. Amy is a parent in the Horry County school system. She says, since the kids are wearing masks during the day, are we not worrying as much about social distancing? My child has an extremely large class, she says, 34 kids, and the desks obviously have to be very, very close. What do you say about that, Superintendent Schneider?
Well, that's absolutely not true. We have unveiled a plan. It's very comprehensive. Facial coverings, masks are just a small part of that. Social distance is another very important piece to keeping kids safe, keeping them healthy, keeping our schools open. Regular hand sanitizing. In Horry County, we spent $1 million preparing for this, hiring additional staff, purchasing PPE, disinfectants, a lot of different components to this safety plan. And my thing that I want to get to people is it's going to take all of us. My teachers and building administrators have done an amazing job. I was in 8 of our 18 schools Wednesday when we opened, and I was truly amazed at the plans that were in place, the organization, the way the kids followed the instructions. It gave me a great amount of hope that we can do this. But it's not just going to be the kids. It's not just going to be the teachers. We're going to need our parents. We're going to need our community to support our efforts. And we've mentioned before, parents screening kids before they leave for school. If they've got any of the symptoms, please, please, please keep your child at home, because the easiest way for us to stay in school is to make sure the virus is contained outside the building. Don't bring the virus into the school, because if it gets into the school, then we're going to face some of these situations that you're saying. A lot of kids are going to be impacted, are going to be exposed, are going to have to be quarantined. So this is truly a team effort. And for us to be successful, everyone is going to have to do their job.
Okay. All right. Dr. Schneider, or Mr. Schneider, thank you so much for that. Now, I have a question. We really opened this up to teachers, and we did hear back from Michael Rust. He's the president of the Evansville Teachers Association, but his concerns really can go to any of our superintendents here. And so I want to bring in Dr. Bleier a little bit here. Michael Rust, president of Evansville Teachers Association, says teacher evaluations, observation rubrics, and processes in general are not designed for socially distanced classrooms or virtual instruction. Teachers and education support personnel have more than enough on their plates, including the anxiety and pressures of COVID-19. So how important are teacher observations, evaluations to you for the 2020-2021 school year? And I also want to bring in the question of state testing, like in Indiana, it's the I-STEP. In Kentucky, you have the CATS program, things like that. How important are those observations and evaluations in this school year? And let's begin with you, Dr. Bleier.
Okay, quickly on the test, the federal government has stated that they want the test to go forth, so we're going to have to deal with that when it comes. As far as evaluations, the state of Illinois has given us a waiver to push back for 1 year all of the evaluations, so we can literally are going to not do evaluations this year formally. We will do informal, and we'll help our teachers through it, but that's one thing off the plate of the administrators, and one headache off the teachers that I know that they're feeling the stress of trying to deal with this. And I've heard from my teachers too. But luckily in Illinois, we've been granted a waiver for this year.
Okay, that's great. As far as all the others, if you could just show of hands, is that true with your other districts as well? Will you be not doing evaluations for teachers or doing them differently perhaps because of COVID? Show of hands, anyone? Basically the same? Okay, go ahead, Dr. Smith.
Yes, if I may, Shelley, our priority really are the students that we have in our classrooms. Certainly, evaluations are required in Indiana. We have taken an approach that we want to coach our teachers to make certain that they have the opportunity to be the very best teacher that they possibly can be for the students that they serve. And evaluations really don't do that for you. Coaching does, but in this time of pandemic, we basically are making certain that teachers have the confidence and have the assurity knowing that evaluations are not the priority for us this year. Student success really in this definition means making certain that they know that they're cared for, know that they are safe, and that their health and well-being is of paramount importance to us.
Okay.
All right. Thanks a lot, Dr. Smith.
Welcome back. As of right now, it is all systems go for high school football in Indiana. And those teams have been in practice mode since the first of the month. Blake Sandlin has more with a few of our SIAC coaches as they prepare for what will be a very unique season.
While teachers and students will be working to curb the spread of coronavirus in the classroom this fall, there's a separate fight happening on the gridiron. States like Kentucky and Illinois have pushed football to the back burner temporarily. Indiana, however, will lace up for the season as scheduled. And while there's certainly risks involved, coaches hope they can slow the spread of the virus by using the right safety measures.
We're sanitizing anything and everything you can imagine, so we're doing everything on our end, to keep the kids safe, and we're still trying to adhere to all those protocols. And it's tough to do it when you want to get in and just play football.
Modern day coach Mike Gable said bringing the sport back will help unite fans and players alike.
I think that society in general wants to get back and have a sense of watching these high school athletes play. They want to play. Everything's so different, so uncertain, but we're going one day at a time.
EVSC Athletic Director Andy Owen knows that there's no perfect solution to bringing back Friday Night Lights in Indiana.
We are going about this with an abundance of caution, looking daily at data from what we've had in July to know what we can do when we return in August. We have had positive cases. We've had positive cases at a few schools. Some schools have not had positive cases. But most importantly, we had positive cases and we were able to continue safely because of the plan that we follow, the guidelines that were provided, and because of the work and the communication of the family, the coach, and the student athlete.
Blake Sandlin, Eyewitness News.
Thanks so much, Blake. And of course, the Indiana High School Athletic Association has held firm in their decision to play football on opening day schedule for next week. Assistant Commissioner Robert Falcons joins us now from Indianapolis to talk about that decision to play ball. Robert, first of all, thanks for the time. And my first question, what exactly went into the decision to continue to play ball as scheduled on opening night next weekend?
Well, the biggest part of that is what you previously heard from the coaches and from Andy Owen at Evansville. Our coaches are doing a great job of making sure that they're adhering to the guidelines set forth by the state governor's office, the state board of health, as well as their local boards of health. And for the most part, they're doing what they're supposed to be doing. They're providing a safe atmosphere for kids to do something they certainly enjoy. And we're going to do everything we can to provide the resources to make sure that continues to happen.
With all the college conferences electing to postpone in the spring, most notably the Big Ten, did that waver your decision at all over the last couple of days to continue to as scheduled for next week?
No, we're gonna hold firm in playing a season this fall. We're gonna do everything we can to play this fall. We've worked very closely with the Indiana Football Coaches Association, and it's their wish that we play a season in the fall. There's some complications of playing in the spring that would make it sort of untenable to play a spring schedule. And so we're going to do everything we can to get a season in this fall, and we're in all signs point that way.
Obviously, we're expecting road bumps along the way. What do you expect the possibility of playing a clean season this year? I'm sure you're expecting to have some pauses throughout the year.
Well, we've got pauses now. We've got a couple of times during the year we're not going to have games because schools are having to quarantine, or they're, we've got schools that schedule Illinois schools and schools that schedule Kentucky schools. And if those schools aren't playing, we've got some open dates on our schedule. So this is going to be a day-by-day process. I loved hearing that from one of our coaches. We've got to win the day every day. And today's Thursday. Hopefully we'll get through practice today, and then tomorrow we'll have the scrimmages and move on and so forth. We don't expect this to be a smooth ride. We know it's not going to be a smooth ride. But our member schools and our coaches, our administrators, and our communities have certainly done everything they can to make sure that we have this opportunity for kids for this fall.
We've got about 60 seconds left. Let's talk about attendance now. Last week, the IHSAA recommended basically 50% capacity for everyone at football games. How did you guys come up with that number? What went into that?
Well, we've getting good guidance from the state. The governor's office has worked very, very closely with us in providing some parameters. And we've been sharing information with the governor's office to make sure we make a good decision based on what's best. Now, just because we set that parameter, there are some local agencies that say, no, you're not going to do 50%. You're going to be limited to 250 people in the stadium. And so we're working through those localities. We have 92 counties in Indiana, so there's a possibility we have 92 different sets of parameters on which to have fans in the stands.
Robert, as always, again, appreciate the time. Thank you very much. Best of luck this year. Hopefully we're going to play football.
Well, thank you. Thank you for having me, and we'll do our best to make sure we have football.
All right, thanks, Robert. We'll be right back.
Back to our superintendents now, and we do have limited time. I want to get to Matthew Constant, Dr. Matthew Constant, about virtual learning. How structured is that really? It's a very loose term, but how structured is that for those kids?
Well, when you think about a virtual environment for our students, we have to think just as we would in a face-to-face classroom in terms of creating that much needed routine that we all crave. And so we have to start teaching our students those virtual habits of mind early. And so in that sense, and we're blessed in our district that we're gonna, I think, be able to provide a device for almost all K through 12 learners. With a device in hand, we can create a schedule for kids so that they know at a certain time they need to be online to see their teacher, to actually see their teacher in that space. So we will be creating those schedules that students will adhere to even in that virtual world.
Okay, thank you very much.
And one question I'm hearing a lot from parents, and this is to, I'm going to pose this to Dr. Smith and and Mr. Schneider as well. What information will you share with parents? The number of cases, are you going to be open? Are you going to post this somewhere? How will parents know what's happening with COVID-19 in the schools?
Well, I'll begin, and I promise and assure parents that those that need to know if they've been in close contact with a positive case will know. We certainly are going to follow Indiana State Board of Health guidelines, Vanderbilt County Health guidelines. I also know that Dr. Box, the Commissioner of Health with the Indiana State Department of Health, has indicated that she may be, or her team may be, putting together a dashboard that would indicate the number of cases in each school.
Okay,
she also approached
Smith.
that with some trepidation because of the legal concerns.
Okay, Dr. Smith, very sorry to cut you off here, but we have to go. And we'll continue this conversation. We really appreciate all of your input tonight. And that's all we have for you tonight, but know this pandemic is not over yet.
Many thanks to our superintendents, and thank you to all of you.